The Connection podcast, hosted by Yuma County Anti-Drug Coalition and Yuma County Mental Health Coalition, is a community-focused podcast dedicated to informing, educating, and empowering listeners on drug prevention, mental health awareness, and strengthening partnerships for a healthier future.
Welcome to the Connection podcast, brought to you by R.L. Jones Insurance. Hi, everyone. I'm Jenny LeGros, Executive Director for the Yuma County Mental Health Coalition, and I represent Yuma County Anti-Drug Coalition as well. And I'm here today with a very special guest. I'm going to allow him to introduce himself.
Hello, my name is Dan Espino, and I am the Division Chief for EMS at Yuma Fire Department.
Awesome. So Daniel's here today. I'm so excited that you're getting to be a part of this podcast, because I know that the Yuma Fire Department holds a very special place in my heart. But you are also now, YFD is part of the Yuma County Anti-Drug and Yuma County Mental Health Coalitions. And so today, I just want to go back a little bit and say how you got here, I guess, so to speak. So back in January, we had challenged the coalition at the meetings to make sure that there were all groups represented. And if they didn't see a certain sector of the community that was represented at the coalition meeting table, to make sure to invite them. And so it was just kind of a coincidence that we ended up in a meeting with the health district together. And I know that Joanne ended up inviting you, which I was super excited about. And then as well, I ended up making sure that I accepted the challenge as well. And I invited Dusty Fields, the current chief. And we were even more excited that you both showed up to the next meeting. So tell us about maybe your experience with seeing what happened at the coalition meeting, and just give us your experience on that.
Yeah, I do want to say thank you for the invitation. And one of the things I think that we're really working on at the fire department, especially at YFD, is kind of telling our story. You know, being a little bit more involved with the community. I think people see the red fire trucks and they see our medic units. I think they know we're doing good things, but we're also trying to do more things like this, where we can give a little deeper insight into the things that we do for the community. So thank you for that invite.
Yeah, definitely. Everyone knows about how to respond to an emergency situation, and the fire department itself that's what they're known for, right? But I do know that you are trying to do some more preventative and proactive measures, especially when it comes to the mental health concerns here in our community. So do you want to share a little bit about that?
Yes. So you know, like as we seek to serve better and more efficiently, we've understood for a while that we have to evolve. 911 is historically known to just pick people up in the community and take them to the hospital. But I think specifically we recognize that we do have a pretty high contingency, you know, people that have mental health issues and also living in the desert. You know, we get those 911 calls for patients that have mental disturbances. And so we recognize that historically we've taken those patients to the hospital, and it's not easy for, you know, an ER clinic or an ER to necessarily have all the resources to treat those patients. They have special needs that probably go outside the scope of surgeons and, you know, trauma surgeons and neurologists, right? So what we are working on is, again, making our services to the community a little bit more efficient. And so we're going to try to partner with, you know, strategic partners in the community to maybe get those patients directly to where they want to go. We've undergone some major changes in the last couple of years, and our new medical director is just all for it. He's all for efficiency. He's all for, hey, let's get your community right to the things that they need. And so, again, historically, just that picking up someone in the community and taking them to the hospital and kind of, you know, being done at that point, I think we're trying to look outside that realm and see what are the services that we can provide and where can we take some of these patients just to get them right to where they need to go.
Right. So as our community evolves with that and the different types of concerns and everything, even more important about the coalition being able to have a place where we have all sectors of the community, many of which are behavioral health and mental health organizations
Yeah.
to be able to come together in one spot at one time to just be able to meet
Right.
and then further their connections to be able to collaborate together on some of these projects.
Yeah, I would say that that's probably one of the most important things about the invitation that we got from you, is that we recognize that we can't do it alone, and so we have to find those partners, especially within the community, that can get us to help get us to the conversations and the outcomes that we're looking for, that they're without question going to come from with outside of the organization. Like, we have all the firefighters and we have all the paramedics, but specialties, especially behavioral health concerns, we don't have the experts in those fields. And so we know that the way to establish those relationships is to be out in the community, be involved with, your coalition.
Right. And just also looking at the organization itself, right? You're talking about community members and mental health awareness and concerns. What do you see with your department itself?
As far as needs that we have?
Sure.
Yeah, I think, if you're talking about firefighter mental health, or are you talking about
Right.
just the community? Well, firefighter mental health, ironically enough, we used to worry a lot, and the predecessors of the fire service were always trying to make the job safer, better PPE, better facilities. All those things continue to evolve as we worry about carcinogens. But sometimes, and maybe even a lot lately, we think about the health of our members and the things that they see, right? Because that is probably going to be the new and latest version of carcinogens, because we go on these calls and we see a lot of horrible things that happen in the
Right.
community, unfortunately. And though, our members take that stuff home with them, they live with that. And so that is also another big push with inside the organization. And I think what we're learning is that, again, not only are we not the experts, but everyone's different. And it's important to, I guess, recognize that. And so I know that we speak with, the leaders within the organization, captains and above, and we're always discussing, you have to look out for your members, you have to look out for your crew, because everything manifests differently.
Right.
And so that's really all we have to go on. We don't know, like, hey, if this happens, then this, but we do know, hey, you were exposed to this, you saw it, how is it going to change you? Is it going to change you? And if not, is it going to change you? But when maybe will it change you?
Right. The leading by example, the modeling, you need to take care of yourself first before you can take care of others.
Yes.
And whatnot. So that's amazing. Again, and moving forward with some of these programs that you were saying, or projects, what are some additional things that you think will be necessary in order to make it work?
I think from a member's perspective, the firefighters that we have, I think that we are constantly, there's actually a team that evaluates our health, and it was, historically been, well, how's your heart? How's your blood pressure, right? How are all these other all these other physical markers? But I think that in the future, you will see psych evaluations be a part of those assessments as well, because we're recognizing, hey, just because you don't have hypertension, it doesn't mean that you saw something that affected you deeply. From a community standpoint, I think it's just moving away from that traditional, you call 911 and we take you to the hospital. It's going to be more about, does this patient have a caseworker? Does this patient need anything that an ER can provide? Or are they looking for things that a specialist can help them with? Because if it is, then maybe we can
Or both.
avoid, yeah,
Right.
well, but we'd love to be more efficient for the community, and especially our mental health patients. Why would we want to take you to an ER setting when we know that what you need is a therapist or a conversation from someone that's specialized in that training, and kind of eliminate that middleman, that stop at the ER, and get you directly to the care that you need.
Oh, that's wonderful. That's wonderful. I think I keep going back to the coalition because it's that same thing where we're not working in silos. We're actually coming to the table and being collaborative in all of our efforts, because each organization can't do it by themselves.
Yes.
Especially when we're talking about mental health.
Yeah, and I would say, like, it's important to recognize that not only can we not do it by ourselves, but we don't have to reinvent the wheel, right? There's all these resources and talents available to us in our community. We just have to find out the channels, right? The avenues that we work together to help each other.
Right, you just said it. Not reinventing the wheel, and also not being redundant.
Yes.
Right, because that's one thing that happened with the two coalitions coming together. So Yuma County Anti-Drug Coalition was well established, had been established for years. However, everyone that was at the table was noticing the common issue that was coming up, was mental health. Right. And so we then in turn created the Mental Health Coalition. But instead of creating a whole separate meeting and all of these other things and objectives and missions and all of that, we knew that everyone around the table was going to be the same around the Mental Health Coalition table. So instead, we just combined forces to do that. And I think that's exactly what you're hoping to do. Yeah,
I think that when, in the fire service, we always look to see what other cities are doing. And so I think that, as the Yuma Fire Department looks outside of itself and across the nation, you don't even have to go very far, honestly. You can go to just some bigger cities. Tucson, for example, has proven to find some solutions to these exact same problems that we have. And so in the near future, we're actually taking a trip to go see how they're handling these specific calls for mental health issues. And the thing that we've heard, and that I think that we're pretty sure we're going to find, is not only are they already doing it and successful at it, but there's even more benefits than you anticipate, right?
Oh.
Like, you're thinking, we're going to solve this one problem, but the reality is the Yuma Police Department runs on these calls as well, and so we might hopefully be helping the police department solve some issues that they have as well.
Right. It's like you said, you're both running on the same calls.
Yes, exactly. Yeah, and sometimes they're there without us, and maybe sometimes we're there without them. But if we can find a more a single focus solution, then we can actually maybe even change call volume for both agencies.
Nice. And then what do you see as far as, I know we've been talking about community, but you were talking about how a lot of the calls you're seeing now are ending up being mental health calls, so to speak. What do you see as far as age range too? Do you see a lot more youth at this time?
That's a tough one to pin down. I actually I do like to look at numbers, just because I feel like that's how you have a stronger pulse. Anecdotally, I would say that the range is wider maybe than it's ever been before. I bet historically there was maybe more middle aged, late 30s, into your 40s. But yes, I will say that is not uncommon these days to also run on younger than 18. We call it pediatric healthcare issues as well.
Got it. And so again, our community is changing, right? And
yes.
And the needs are changing.
Yes.
So we have to be ready and work together to find those solutions.
Yeah, I think that's probably been the thing that has been driven home the most to us is, as we take all these numbers and we analyze response times, and we analyze call types, and we analyze destinations where we're taking our patients. The thing that probably rings true is that we have evolved. I'll say, I don't think we don't have small town problems anymore. I think we're on our way to being a legitimate city, and we have a wide range of patient age and a wider range of patient complaints.
Gotcha. But the good news is we are growing, but we still have that small town community feel. And I know that this community steps up.
Yes.
Whenever there is any type of crises or whatnot. But it will be really awesome to see where this takes us, knowing that we're on the preventative end and we want to collaborate in order to work on this together. And it's a good thing to see when the community comes together and knows now that this mental health awareness is something that can be talked about,
Right.
and it's okay to ask for help, and we are finding ways to get anyone that needs that help the help they need.
Yeah, I think I hate to say it, be a broken record, but in the fire service is, traditionally almost unheard of, probably, to be someone that's willing to come forward. And so I think again, it is probably extremely important, and I think that's the importance for our members, is understanding that mental health issues are real. I think in some shape or fashion, we probably all deal with a different level of them. We all have our own stressors, the things that are stretching us. But I think that it is reassuring to know that I think we're moving in the right direction towards accepting that it is a reality, and maybe even more reassuring to understand that the community is willing to take it on together, right? Like you said earlier, none of us have to feel like we're siloed away dealing with it on our own.
Yes, reassuring for sure. Well, awesome. I'm so excited that you were able to come and chat with us. Is there anything else that you would like to share on behalf of the City Fire Department?
I think just where I started, we have been really bad at, I guess, telling our story to the community. Like, I can remember for so long, I feel like if you were to ask me, what was the number one question you ever got asked? And it was like, well, I saw a fire truck and an ambulance going down the street, but I didn't see a fire anywhere. Where were you guys going? And so I think after years and years of almost on a revolving door being asked that question, the story that comes to mind is that we are going to work really hard to be better at this stuff, to tell our story and help people understand. The Yuma Fire Department is an evolving organization, and we're really working on being more than what we were in the past. And I think we've traditionally been a really strong department, but we're going to grow and serve our community's needs in a more efficient manner.
That's awesome. That's the best news. Well, we're going to end it there then.
Perfect.
Awesome. Thank you for joining us. Remember that you can see us on all those social media handles, YouTube, Facebook, Instagram, Spotify. Check us out at ycadc.org as well, our website. Lots of information and resources for you. Just remember, I'm going to leave you with this quote. It's my favorite. It's by Johnny Weathersby. In every day there is a best moment. You just have to find it. Bye for now.